everyone, this is Princess G. Villarreal, and in this video, I'm going to show you and share with you on how to do the proper hand hygiene or hand washing procedure. Hand hygiene is a way of cleaning one's hand that substantially reduces the risk of potential pathogens or the harmful microorganisms on the hands. Hand hygiene is considered a primary measure for reducing the risk of transmitting infection among patients and the healthcare personnel. So, in this procedure, this includes the use of alcohol, hand-based rub that has 60 to 90% effectivity, and hand washing with the use of soap and water. So, for the purposes of this hand hygiene procedure, this is to reduce the number of microorganisms on hand. This is to reduce the risk of transmission among the clients and to reduce the risk of cross-contamination. And lastly, to reduce the risk of transmission of infectious organisms to oneself. So, before we begin our procedure, we have to make sure that we determine the location of the running water and soap or the soap substitutes. And for the equipments, we'll be using a soap that can be in form of liquid, in a bar, granules, and in sheets. And of course, the running water or the warm water and the paper towels. So let's begin.
Turn on the water and adjust the flow. Wet the hands thoroughly by holding them under the running water and apply soap. If the soap is liquid, use 4 to 5 ml or 1 teaspoon, and if the soap is bar, granules, and sheets, rub them firmly between the hands. Use firm rubbing circular movements to wash the palm, back, and wrist of each hand. Right palm over left dorsum with interlaced fingers, and do it vice versa. Next is palm to palm with interlaced fingers. Next is back of fingers to opposing palms with fingers interlocked, and do it vice versa. Next is rotational rubbing of left thumb clasp in right palm, and do it vice versa. Also do it with other remaining fingers. The circular actions create friction that helps remove microorganisms mechanically. Interlacing the fingertips and thumbs cleanse the interdigital spaces. Next is rub the fingertips against the palm of the opposite hand, and do it vice versa. The nails and fingertips are commonly missed during the hand hygiene. After at least 30 seconds, rinse the both hands. Get the paper towel and thoroughly pat dry the hands and arms. Moist skin becomes chopped readily, as does dry skin is rubbed vigorously. Chopping produces lesions. Discard the paper towel in container. Use new paper towel to grasp a hand-operated control, because this prevents the nurse from picking up microorganisms from faucet handles.